So, two important things that we have to keep in mind when we do microneedling. Where we're microneedling in the depth. Very, very important. So, for example, I will not go beyond 0.8 in the forehead. Unless there's very big scar that I need to treat or big pimple and so forth. But in general, for normally, we don't go more than 0.8 in the forehead. Under the eye treatment, you have treatment. So again, we don't go more than 0.4. Okay, the cheek you can go up for normal duration. You can go up to 1.2, 1.5, but no more. Unless you have a scar, she have acne, you need to go underneath. And then the chin and the everything, maximum 0.1, 1 or 1.0. Okay? 1.0. Now, when we do the hair, again, the same thing, same technique. We call it the sandwich technique. You apply first, you microneedle, and you apply again. Okay? So it's the sandwich technique. For the hair, the same way. Apply, you microneedle, you apply again.
What about the depth?
The hair do not go more than 0.6. 0.6 for me is good. And also, so this is the depth in general. Then the technique, how you apply it and how you use the technique. So for example, so I'm going to show you a little bit because she have a certain frequency, so I'm just going to go a little bit. But in general, medium is the best way. I go a little bit less when I go under the eye treatment. Okay, I'm not going to do her eyes, but I think she had already.
But with just a needle, how we do the eye treatment? With just needle?
Yes.
How we do eye treatment with aqueous solution?
Yes, so I'll show you right now, but I'm not going to do it, but I'll show you. Okay? So, are you doing is done, Phil? Okay. So, when I see people on social media and doing it, they go like this. This is called the glide technique. And even the people who made this product, Dermapen or Neopen, they go like this. They show you to do like this. They have no idea, and I don't know why. Frankly, I still don't know why. But I feel like it's easier. You're like, oh, you go like this and make sure it goes red or blood. No, that was the old microneedling before, because you know the microneedling came from Asia, and they feel if you get blood out, that means it's good. And then some doctors who are genius, they tell you, oh, do like this, when the blood come out, go put it on top of the area because it's PRP. Please, do exactly, you know, do whatever you want, but follow me, I don't know, do what I tell you, and you're gonna get great results. Your patient will love you, and they'll be over, you know, and the result without causing issues. Now, if you look at the skin under the microscope, or you take a picture of it, you're going to see a lesion when people do like that. So you're no, but the needle is so fast. No. When you do like this, you're scratching the skin. You don't want to do scratching. You want to go in and out. And then let the product do the job for you. This is not the treatment. This is a delivery. This is a vehicle. Your treatment is this one. You trust the treatment, trust the equipment, and then let it do the thing for you. If you start doing like this and say, oh, you have to show the blood so the skin can work, that's not true. So can you, again, also when you get this product, like for example, all AQ products, make sure the seal is closed, okay? If it's open, do not use it. That means somebody has temper with it. So once you do that, you just go like this, push it up, it comes out. And then we put the mechanical here for we use like this for hospital, if you use like big areas. But for you at your clinic, you open it, you leave this in, and then you use the syringe. Inside, it's not liquid, it's thick serum. And I don't know why doctors do like this, and then they pull it out. And then they tell me, well, I only got 3.2 of it. Doctor, I don't know. No, this is thick serum. Thickness goes down to the gravity, right? So you keep it down, like this, and then you put your syringe, and then you pull. There you go. You see? Simple. Don't go like this. This is not liquid. This is not, you're not injecting insulin. And then I get around 0.5 here. Now, when this is a syringe, this is a pointy syringe. When you do a pointy syringe, what do? You don't point it at the face. You point it out. And then the gravity brings the solution down. Okay? So don't go like this and squeeze it, no. Put it like this and then you apply this. You see, I'm putting here. Wherever I want, it's easy. Okay? See, and the patient is comfortable. You don't have to take the risk. Now, what I do is, you see, she have a little bit pimple here. I can clear this for you soon.
Yeah,
Good.
can treat it?
Yes. Very simple. So you see, I swear. Now, don't keep rubbing it in. You don't need to do that. You just rub it in. See, very simple. And then, so I'm going to put 0.6. You took the cover? 0.6, and I put it medium speed. Patients usually have anxiety when they come here, so the needle, they don't know how to feel, and they're like, you can see. So the best way to relax here is to go like this.
No patient with doctor, no problem.
Yes, I know, but I'm talking about everybody. So in general, what I do is I go in and I let them touch it like this. How is it? Once you do this, the patient relax, so they know. And then you see I'm going like this. See, I'm going back and forth. I'm not going like this. You don't do this, okay? You see? Now this area, when you have members, it's a point of concern. So what I do is usually I touch it quickly, okay? See, then I go again, see, back and forth, back and forth. And I do 3 passages with 50% overlap.
This is 0.4.
0.6.
0.6.
You know, for me, because she volunteered, I want her to get good results. So, you know, you see, I'm doing this.
And what's the instructions after the treatment?
I'll show you. If there's an area of concern, you can do it. Are you okay?
Point,
Yes.
they will not fly in point.
No, I don't do that. See?
Yes, same thing.
And then I finish, I go back. I can talk about it a little bit.
Do you
Okay?
feel any discomfort? Do you feel any discomfort? Some discomfort, but not so bad. It's okay. It's not so bad.
So,
Not comfortable, but it's okay.
can you hold this like this? So now, once I'm done with the first passage, and now I put again.
Is another product?
The same. But we do it a sandwich technique. You see?
So 0.5 for each
0.6, I would use 0.6 because I think, you know, since she's volunteer, I want her to get good result. I can use 0.4, will be fine, 0.5 will be fine. But maximum, I will go 0.8. There's some issues, I go 0.8. You see, I apply it.
In
And you see this.
total or for the first or second? Like
In the forehead.
no, in like both times you did 0.5 in total, or before you use the microneedling and after each
Yes,
time?
I use 0.6 for her.
In total.
Yes.
Okay.
So you see, I put my hands here, I put recovery on top.
doctor,
Which
for
how many
You can see
post-acne.
there's no blood comes out. It heals that fast.
For post-acne, you do a selective nasal with
I didn't understand.
post-acne here.
Post-acne, yes.
Yes.
So if you have post-acne, I will usually go deep. So when you have a post-acne and you have, so the skin doesn't look straight like this, it looks like this. This is how you look at our skin. So for you to build this up, to make it normal, you have to go first underneath it. You have to go deeper. So you cannot use somewhere here. You have to go underneath the base. And then you break this area. So you have to make the cells from here all the way here, they have to connect. So you have to break all this gap. And you put growth factor. What the growth factor will do is start all these cells that you touched will start growing. And now they're going to start filling.
But you do it selectively, or you're doing all the area?
I do all area. I want them to benefit from one same time. I want the same scale of skin to be, even. So I do the whole thing.
And an active
Is
acne,
there a
you-
contraindication if she has a Botox or any?
Yes, these are my questions.
No.
Exactly. No, it's not
The
contraindication.
only thing that we see with very, 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 very rare is some people react to some of the ingredients, like allergy a little bit. In this case, usually we stop them and it goes away within 3 days.
and the active acne.
Active acne, no. Active acne, we put numbing solution, we do them, and then, and usually after a day, they're fine.
My question is, the treatment would resolve the Botox more quickly than
Botox?
normal?
No.
No?
Botox, when you inject Botox, you have to go, for example, frontalis, it has to go a little bit deeper. So nobody inject Botox more. You have to be at minimum 0.2. Minimum 0.2. Sorry, 2.0 minimum to get the toxin and the muscle.
No, the movement of the.
Doesn't matter.
But in the
not
same
any
day we can
effect?
do it.
I don't like that the same way. The reason why,
Because
because you
I
don't want to
tried.
have migration. So no. If you're gonna do Botox, like just what I showed you before. She came in, she have good skin, I do Botox. She have not good skin, I said let's do your skin first. Come after a week, let's see how it is, and then I can do your area. And that includes fillers too. Filler you can do the same. Botox and fillers.
So you start with this treatment and then the Botox and the other aesthetic
yes. So
treatment.
this is the discussion you have with the patient. If she have, it's concerned about her skin, then you can have this. It's already done. She responded good. So you know what I mean. So this is the forehead. Now I'm not going to do her eye, but I'm going to show you the technique. Okay. So the same thing.
Could you explain how you treat the active acne? I mean, you do the microneedling on it or just
Yes.
put the serum? You do it
No.
exactly the same?
You do the microneedling on it.
Okay.
What do you do
What
with acne?
with acne? Like the same with the dip of 1.5.
So you go on it.
Ah,
And
Deeper?
where's the 400 guy?
On it, 1.5, but how much serum do you put?
The same. The amount of serum is the same.
Okay, so again, just microneedling, serum, and then again.
Serum,
Serum,
microneedling,
microneedling,
serum.
serum.
Yeah.
Sandwich.
אתה עושה את זה על אקנה פעיל?
על acne פעיל.
Now, one question they always ask me, doctor, but if you do this, you spread the bacteria everywhere. Now, the bacteria name is P. acnes.
זה
The
אנאירובי.
P. acnes and anaerobic exposed to the air will kill it. And the reason that actually, if you take anaerobic P. acnes and you give it to her IV, it will not survive. The bacteria will die. The immune system can kill it. It's not a strong bacteria. The problem, it hides in the fat area. So we call this immune privilege. The immune system doesn't see it. So before, some of us are old enough, we used to prescribe 6 months of tetracycline for 500 for 6 months. The reason why, because until we reach the bacteria, it takes us that much of a dose. Now we have tritonium and other medication, but you guys don't use tetracycline still. And this is why you guys don't use it, I'm sure.
Allergic reaction, how often have you seen?
Rare. My case in the last 10 years, I've seen 2.
You cannot know ahead of time. Just
I'm telling
during
you,
the procedure
I'm
or
speaking to
after
you.
the procedure.
I'm speaking to you as an immunologist. Allergy can come from the first time a lot. Like like people who come to me like, doctor, I used to you know, dye my beard all the time and no problem. And suddenly I did it and my, you know, my lips are growing, like, you know, it can't happen. She might have no allergy history, and it can happen. So, but it's very, very rare. Now, the good thing is the ingredients we use in this product are all non-allergen. This is non-allergen, so they have no history of allergy. But, you know, one person in south of China developed an allergy for whatever reason, exposure. So, but it's not complication. She's not gonna have hypoxia. No, she just have redness, little bit of, you know, itchy. So I told them either you can relax for 2 days, you know, it will go away, or I can give them cortisone 5%, you know, cortisone. They can use it topically, but it doesn't last long. It's not serious. But if okay. With the eye, I do the same thing. Like for her case, she doesn't have any problem with the eyes, but just the normal rejuvenation. I will put it under 2, like 3.3. This is my favorite depth, 2, 3. I put it, so I put it, see, 0.3. I reduce the speed into minimum, and then what I do again, I put the solution. So I take the syringe. Okay, can you close this camera? And I point the syringe where? Away from the face, and I tell the patient to tilt, and I put the solution here. I go like this, I put it here, okay? Once I put it here, I put the syringe down, then I use my finger. When I take the solution and I use my hand, left hand, I pull the skin down as far as I can. Then I use my finger and I take it all over under the eye. The reason why, because I want to take more of the skin away from the eye and put it, you know, pull it down. So this way I have more area to work on, so I don't get closer to the eye. And then I tell the patient can close their eye and look up. Say, look up and close your eyes. And then I do the tension. And then I go from here all the way on top of the orbital bone, the inferior orbital bone.
Can you show in the other eye so we can see?
Yes, so.
Again.
And this side?
Yeah.
Yeah, again, so.
Was your picture?
I go like this. I take the syringe and I apply away here. I apply here. Okay? Once I apply here, then I pull the skin down, use my finger, and I go like this.
To the infraorbital.
Yes, infraorbital, all the way. And then I start with the microneedling pen. 0.3, I keep pulling down, I don't stop. And then I go like this, all the way into the medial area here. Why? Because when you have dark circle, it starts from here, doesn't start from here. Start from here and then give you. So you need to break, it's not a ligament, we call it ligament anesthetic, it's like this, whatever. Anyways, so this ligament here that starts, we break it down right now. So it doesn't continue the circle, then you have a raccoon eye. So we do this and then we go down. And I do 3 passages while I'm pulling down. And then I put the solution again and that's it.
How close to the eye do you get? Like,
I pull down and I go on top of the bone. Remember, the microneedling does not work unless you have 2 things. One, the skin has to be flat. You don't, you know, I see people like, you know, other companies, when I go to conferences, they're showing workshops, they're like, so we do this and then he's going like this and, you know, you get amazed how nobody want to think. You have to, remember, let's look at this. For example, if I do like this now, you see who's absorbing the absorbing. The skin is not getting it. It bounces in and out, right? You see here, it's going in and out, you see? If I go like this and I pull, and now look at it.
yeah.
Understand?
Same. Okay.
So you have to do that, yes.
Try to do some light peeling before you are doing it. For
If
the
you do peeling, you don't do microneedling. Rule of thumbs. Peeling, no microneedling.
super light. No, no. Okay.
Either peeling or microneedling, but you don't do it together. Rule of thumbs.
But time between peeling and microneedling, it's okay? How long time?
You did.
I did peeling before 1 month.
Yeah, that's fine.
It's fine?
Yes.
At the same time, it's not.
TCA?
Not so to say this.
What we call
Acids,
an
some acids, I don't know.
medical
exactly what
history
it is.
ahead of
So,
time.
okay, again.
1 month.
Now,
Okay.
I'll tell you, yes, 1 month is okay. But if you want to make sure and you want to have indication, I give you my trick. You go in and you see if there's lipid outside. One way to do it for me, I get the paper and I put it like this. If they see lipid, then it's fine. If there's dry and no lipid, then you are a little bit earlier. Because remember, we do TCA, if you do any peeling, the fat production goes down. So this is how you test it if she's ready or not. So I can see that now it's shining, so she's fine. But I'm not going to do it for her, but I'm going to, because she have
You
little
wasn't
things.
able to diagnose ahead of time?
Now, so you understand what I'm talking about? Now, the eye, so the cheek, you apply it here, you don't go like this, please. Don't do this and embarrass me, embarrass everybody, embarrass yourself. So don't know. See, I'm pulling down, I'm going in. Now, if you want to do a facelift with microneedling and growth factors, it's amazing treatment.
Yes.
Amazing. So this is what you do. This is my trick. You apply the growth factors on the jawline. You massage it. And then you use your hand and you start from here and you pull all the way. Just keep pulling as you can. Once you reach that very part here of the ear loop, you stop. And then you microneedle from here. Don't go like this. From microneedle from here all the way up. 3 passages on the mandibular. Boom, 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 boom. Again, boom, 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 boom. You do it here, and then you go all the way up, and then you release. What you did here, you directed the production of collagen in one direction with the growth factors. So she'll wake up tomorrow, and her face will be dyed, and it stays around a month to 6 weeks, give and take, depending on her collagen production, and it's fantastic. I've done this for a lot of celebrities in Hollywood before the shows. Now, if you guys are gonna do weddings or any occasion, please, 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 don't do it 2 days before the occasion. I know you're good, I know you're fantastic, but don't push it. At least allow 1 week to do the treatment before. So, if you must, and there's nothing you can do, and you're very confident in your ability, then 3 days. Please don't do it the day before, and don't call me if you did it, because I'm not gonna help you. So this is how you do it, okay?
What happened after 6
Are you tired?
You can
Water?
yes. It's okay, it's okay.
Okay, I'm going to do the neck a little bit. I'm going to show you how to do the nose and the pores and stuff.
Neck,
Okay.
nose,
I'm going to show this. خذوا صوبوا فوق ولا من هناك خذوا الصورة. أيوة good. Okay, quick. The neck. I know everybody asking about the neck. The neck. Neck and the décolleté. Okay. So.
صورة ولا فيديو؟
No, أنا كنا أقصدها من فوق الجمع الكبير هاي. No, I'm gonna. Okay, let's focus on this. Okay. So I'm gonna do this. So I don't care, but I just thought الجمع الحلوة هذه. So yes.
دكتور يلا خليه يشوف.
Okay. No, while I'm
Spontaneous.
now when you do the lines of the lips, okay, you ask the patient to go like this. Where there's no redness, you see discoloration, you don't do it. So you go like this. Go ahead. Then you use your fingers, you put them here and you stretch all you can, and then you go on top with the growth factor like this. This is very good for the vertical lines, called smoker lines. But now make sure you don't touch the pink area. It's the nerve here is 10 times, maybe 100 times more than in this area. Okay. So if you touch it with needle, it will be very painful, and you're not going to do any good. So make sure you go like this, and then you stretch it for the lip line. Okay. So this is the lip. When you do the nose, so in Asia there's a lot of pores in their nose, and they get if you squeeze like this, you see oil coming out. This is, I think, in my opinion, is the only treatment. Some people use laser. I don't like that, because then you have to create a pigmentation point. I don't like laser. Some people use, yak. Also, I don't like that, but you can decide on this. So if you're gonna do the nose, this is what you do. First, use your finger and you put it here, and then you do it this way. Please don't go like this. Sorry, like this, because you see it bounces. You're not giving it. You put your finger like this and you go like this. You see?
Contra.
Yes. You see how the difference?
From the other side? Yes.
You see the difference? Now, when you go to the tip, the same thing. Use your fingers. You put them in the opening. You squeeze a little bit and you push up. Now you see, I have more flat area to go in. Good? Everybody, huh? In the nose, 0.3 is enough. 0.3.
Yeah.
0.3 is enough. Okay? So this is how you do it. This is how you do the lip. Now we go with the neck. The neck starts not from here. It starts for submental, under the mental hair. Here the neck starts, not here.
I just want to ask a question for the lips. You need to take peel, Zovirax peel, before Zovirax.
Zodiac.
No, you don't, no. So the neck starts from where? Here? Yes. So look at the jaw line. Look at the mandibular all the way. This is the neck starts down here. And stop in the clavicle. Okay? So you go like this. You choke here and
Thank you, doctor.
yes. So, and then you pull your neck. You see, I'm pulling down all the way and I'm resting in her clavicle. You see? So you can see the sternocleidomastoid, you can see all the holding. You see, I'm holding it. Now look up and move a little bit. You see, I'm holding what? I'm not leaving my hands. Now you see the tension? Then you see, I can go like this. And then, yes, so you go up and down. Up like painting. Here I use 0.8. 0.8. 0.8. Yes, 0.8. So you see, I'm doing. I don't. My hand doesn't move.
Painful. Painful.
No.
Yeah.
Not painful at all. Very nice. So you see, I'm doing like this, and I'm painting up and down 3 passages, and then I release. Now go down. You see, if I go like this, you're wasting your time. It's impatient time, and frankly, huh?
Sandwich. Serum da.
Serum. I always sandwich. Always sandwich. Always. Unless you're using laser, then you have to use it at the end, because if you put liquid and laser. So this is clear with the neck. And now the décolleté, how it's done. The décolleté is from your shoulder. See this joint here, the shoulder of the clavicle joint, this one, all the way to the sternum, the mid, which is here. This is the décolleté. Now, if you do it, the chest, this is not the décolleté. The front is called décolletage. It's like this. So the sternum, not here, the 54, you go a little bit down. Okay, so in midway between the sternum, the angle of Louis, and the xiphoid. Okay, here, this is your décolleté, and you go it like this. The same. You spread the skin, and you go this. Now, she's fit and skinny, so that's easy. But when you have somebody who have a little bit of, then you have to make sure you space it and you go straight, back and forth again 3 times. I use 1 to 2 depending on the type of patient. For hair, I'll use probably 8 to 1, and it's very good for the summer or people who do this. Any questions? Any area you want to treat?
What is the effect of the sun?
Yes.
1 millimeter.
And how much
Do you mind if I touch your here? Do you mind? If I can touch?
If he can't touch it.
Did you mind?
Yes. So you are. So this is part of the deluxe treatment in the clinic. The patient like it. With this. Oh, now what's your name?
Omer.
Oh no.
Omer.
Omar. Oh.
Like Omar.
Omar. Okay, Omar. And Omar, I got a text message from the great Kifir, and he showed me your results. And it's actually not bad.
Not bad at all, but still have some deep
Yes.
scalp here.
Okay, so it's from the first picture I saw, you have a lot of improvement. And I don't look at this only at the physical, like I don't see, oh, he have this kind of skin, no. I look at the tone of the skin, because if you have different tone of the skin, this will be magnified by 5 in terms of appearance and overall look, So look at his tone. His tone is quite actually healthy. This redness, meaning there's some issues underneath his skin. So he has some issue underneath the skin. And this is actually, this is an acne, right? Acne? acne.
Post.
Yeah, no, but what caused this acne? So this is aggressive. This is cystic acne. This is aggressive acne. So usually, some people when they get acne, it get aggressive. When you have two heads, they joining together, kind of thing. So you'll have more space. Probably he had it when he's young. Yes, young. When you have the acne.
Yes.
Yeah, so and it stays for a long time, a period. So it's kind of yes. So this is how the this one. So sometimes people don't have this pen. They use this one. It's fine. You can use this one. The same technique. You just instead of going like this with the pen, you do it with this one, and you overlap. It's the same thing. This allows you to give you different depth. It also allows you to give you different depth. So it depends what you like. I'm gonna at the end, once I finish, remind me to tell you about stretch marks. I know it's important, and it's quite a lot. It's great result, unbelievable result. I don't think anything works for stretch mark except this mechanism. But the technique is difficult, so I have to show you how to do it. Okay, so now what am I doing? Am I treating him? No. Okay, I'm treating him, right? Yeah. Okay. So did we change the needle?
Yes.
Yes. Okay. So now, just to be honest with you, I will not be able to do your face. I need to go a little bit deep and a little bit different. So what I'm going to do, I'm going to show him how to do certain part, then he can do it for you, okay? Because it will take a little bit of... So this is how you do assessment. First, you see the acne, you see the space, right? So I'm going to do, for example, this area here. I'm going to do this area for him, and then the rest, if you can do it. First, I determine how deep it is. And the way you determine it, you touch it a little bit to see, get a feel, and then you reflect it to the light. See the curvature. Now, your eye was not designed to show you exactly what the length is, but think about this. Every time the light is visible by light, that means you are 0.5 deep. So I told you how much you use for the cheek.
0.8
to 1, right? So 0.8 plus
1.3.
0.5. How much you have?
one.
So this is how you calculate it. It's really deep. For example, this case here, 1 here. So this is how you do it. Normal level plus the problem we have. Yes.
The deepness of the scars.
Yes. So now we know how to calculate.
No.
Yes. So normal. Oh. No, you block. So I'm going to do this area here because this is the parent, so this just so he can get the result now, and then with the rest you can take care of it. I know you want to show us the one before. You can show them. You have a picture on your phone. No, he does. He just put it the picture. The one you want to show me? Yes, yes. So this is how he looks before. No, he's much better. Thanks to him, but he's much better now.
In the light.
In the light.
We have the same light here.
So again, I don't invert it. I take it this way. I put it in. This side, yes. Well, I think it's a lot of improvement. They think it's improved or not? Yeah, he thinks. No, does he think it's improved?
Yes.
He thinks, yeah, he's happy. Yes. Well, so let's do this one for you right now. So again, the needle away from the face, away from the eye, I drop. And then here I will use, in this, here I use 2, but here I will use 1, and then 1.8.
So what speed you will use?
I will use medium.
Medium.
Usually I use medium and low in the face, and then if I do scar, I go fast. So I put 1 point, so here 1.7, medium because you don't have 0.8, and then I start.
So don't change anything from patient.
Change
כן, החלפנו.
Of course, of course.
Thank you for your care. Okay, so again, what do? I straight the skin. You see, I got it out. You see, and then you see, I straighten the skin, and now I go in like this. Oh, he had lidocaine.
כן, זה דפיים. כואב לך? לא. מה בוזה?
So you notice me, I'm going a little bit in an angle side, right? I'm not going like this.
אמר אצלנו בוכים, אה?
עכשיו אתה לא בוכה, אה? לא כואב לך כלום. לא. בגלל שהדוקטור עושה, לא?
I'm not that comfortable doing it here because I know it's weak. I told, but I need somebody to hold it like this. I know it's going to be like this because it's okay. I'll put the كمية البلاد. شفت البلاد؟ أقول لك إنه ما نقدر نعملها في الكلينيك.
قديش بتحط كمية كل مرة؟ كمية
Just around 0.21, 0.2. So, but you know, I have to break the scar tissue. That's why I have to do it this way. You understand?
I want sandwich now.
Yes.
You are not cleaning the blood?
You don't clean?
I'm going to show you something.
You want to
I'm going to show you something. So, you see how it's bleeding right now? Once you apply the growth factor on the top of it, yes, stops.
Wow.
Stop. No bleeding. And then you see the red, this is becoming red so fast. You see? This is the dialysis, this is the PDGF now working, and the TGF. You see they're working. Now they're breaking the scar tissue from down and pushing it up.
Every time you put 0.
So, because we're not in a clinic, I cannot do deep and whole process. So usually if he comes to me, I will spend around 45 minutes and it will be quite messy in a way. Because the growth factors are here right now, as you can see it already in a huge amount of working. And you see I done around it and I went a little bit in and I broke the scar tissue. You can see the growth factors already went in and start working in the area exactly where the problem is. You see I did all that. You see the difference?
The skin absorb the material?
Yes. Very well.
Very well.
I just show you. You see I squeeze. There's no blood.
No, I think I mean later. No?
You're done.
وهيك بيروح.
Take it over. I'm just going to give him extra salt here. It's better to use it for him to throw it away. You can see.
And you do the same for the face everywhere where there's
Yes. And you know, it's quite a process, but
ممكن تستدعي مريضة. For the treatment.
3 months later you can
give me your phone. Get out your phone. You can see how you can easily have.
Send him the picture.
You can see. Take care.
אתה יודע? הנקודה היא?
You want to feel it? I can give you glove. For hair, right to 4 quarters. So I do quarter one, the same like this, and then you go back.
What about the eyelash? وريهم بس دكتور.
show us again.
دكتور وريهم شغل الشعر أخرى مرة. وريهم شغل الشعر.
عشان نصور.
The eyelash.
For the hair, we'll show you really quickly because of the time. In general, yes, because you're not going deep. But you know, for me, usually, if they're taking heavy things, I would say I'll tell them they will be bruising, they'll be bleeding a little bit, but you know, and if they're bleeding, I'll do it. Again, I take the solution out. You see, take the hair. No, I use 0.6. Yeah. And then you see, I put it here. I massage. You see, I'm massaging. I'm massaging. I'm massaging. I'm massaging. I'm massaging. I'm massaging. And then we do. You see, I'm putting 0.8, 0.6.
0.6.
Yes. Why? What's wrong with the battery? You see, I'm putting 0.6. I put it medium speed, and then I press. And then you see, I'm going like the same. I'm opening the skin and then going like this. No, don't like. 3 passages.
Where?
3 passages. No, you don't feel it. Yes, I spread the hair if I wanted to do, and then once I do that again, I apply the
But
solution.
for people, like for girls that have long hair, so I think
You
it's
use
more,
separation. You separate. You separate. You
What
do it
about local anesthesia in the, no?
not painful.
Not necessary?
This one necessary
In the face is more sensitive than
because
the...
I'm going deep. But in here, no, because I'm going to you see, I'm massaging it, and that's it. Yes, always sandwich, always sandwich. See, I'm massaging it.
And
I'm leaving it.
after PRP, can we just make the massage and then and that's it? That's it? Or don't believe in?
I don't believe in PRP.
How many times you will repeat this treatment?
Left in this vial. This stay with me in the clinic. This I give to the patient. I told him every other day, put it on the area and massage it for 5 minutes. 10 minutes you massage it. Just use a dropper. I give him like a series like this. I say pull it, put it on. Usually I take the needle out and it will just open this up and take it out.
Not
and massage
penetrated
it.
this,
No,
it's not
just
penetrated.
no microneedling, just massage. So when he come again after a week, the stimulation follicle are there. Then I do a treatment for him. Then he comes
Give him
again.
another,
In between, I give him one for 5 weeks. You can do 10 days. It's not whatever, but usually that's the process for 5 weeks. The result comes, and then take good pictures and make sure you look in deep because the result come after the last treatment. A month later, you're going to see result coming. Now the patient, he will tell you today, doctor, I feel itching in my same area. That's normal because you're stimulating a lot of follicles, so you feel like, oh, it's something. How do you do it? Don't ask him to scratch. What you do? You go like this.
Tapping.
You tap, tap, it goes away, okay? Don't use any medication, don't do things, that's normal. So this is the treatment, this is the thing. Look, he's building, wow. Because he's young, that's why.
You should take a picture of the hair ahead of time.
Can we use your stomach?
Abdomen.
Abdomen? Tell him.
It's
So there's a lot of stitch mark here. I call it the squeeze. I'm not going to do this, I'm going to show you. So I spread the skin. I spread it. Then I squeeze it and I push it up. And then I go like this, angle like this, and angle like this. And I go 2.5. Yes. Yes. Stretch mark. Again, pink or white, doesn't matter. You see, I'm going like this. I'm not going like this with him because he's just going to absorb it. And even if you do this, remember, the skin will still absorb it because there's no bones here. So you have to spread, squeeze, and push up. And you go, and you do it like this. It's very hard work, and usually for me, the way I do it, I do one sector, and then patient come back again. If I see good result here, then I finish. Instead of doing it again and again. This is the way of doing it. Yes, so stretch mark, if you do abdomen, thank you very much. If this line in the buttock, this and that, whatever.
Which seal?
I mean, first treatment is the
Which seal for the
No, the recovery.
recovery?
examination.
Always recovery.
First treatment is the examination if the treatment is good.
Yes, I do sector, everybody have technique. I know people, they're very good, they do it first time, they know. And I send patients to them because all they do is stretch mark. They're busy, so I say, hey, are you available on Thursday at 5? Why, doctor? I want to send somebody. They're like, okay, for you, we'll stay late and we'll do it. But in general, this is, for me, I don't do it because, but in general, this is how you do it, okay? Spread, squeeze up. 1, 2, 3 in angle, because the stretch mark, remember, they don't go straight, they go like this too. Okay? And they go deep. Usually you don't see blood, but sometimes if there's blood, that's fine.
You squeeze it, okay?
Yes.
And then
Any
ليه؟
questions? Perfect. Okay.
شامس مفروض.
Thank you, doctor.